Good morning, everyone. We are going to go ahead and get started. Welcome to our second session of the Measures and Methods Performance-Driven Academy of 2020. A reminder to all of you that this session is being recorded, and welcome to you. We have a lot to cover today. I did want to say in our welcomes, if you have any questions at any time or about connectivity or content, please chat them in. There are a couple of folks from our team here at CCSI who are going to monitor the chat for me, or for whoever's doing the hosting today, since it's kind of hard to watch the screen and monitor your chat, but there are people watching in a good way. And also Jocelyn is on. I'm sure many of you have emailed with her about so if you have any issues with getting onto Teams or with hearing us, please chat to her directly as well. This session materials, the tools are already actually on Teams in the files, and the slides will be up shortly. The recording will be up later today or early tomorrow, so you will have access to all of this stuff later, and you have access to some of it already now. As usual, also, if you have any issues, please feel free to email pda@ccsi.org, and Jocelyn can help you with whatever you need there. I am Dr. Brianna O'Connor. I'm the Director of Strategic Analytics and Performance Improvement at CCSI, and the upstate partner for the MCTEC and CTEC initiatives. Joining me today will be Lynette, our senior consultant, who is going to introduce herself when she starts in a few slides. What we have today is our very best attempt to take kind of dry content, which is creating a measure, and we've broken it out into some steps. There's going to be 2 different breakout groups where you can talk it through with others from your similar organizations, and also just kind of break up the monotony of hearing one person on Zoom or 2 people on Zoom. I'm going to just really kind of quickly, probably not even 5 minutes, just cover some of the quick highlights from session 1 for folks who are new, or just as a reminder of what we covered. We will get into, Lynette will lead the section on measure description. What is a measure description? What are some examples? There'll be a breakout group where you will go with some other 5 or 6 folks and come up with what you think might be a good one. We'll have, after that, you'll come back and we'll show you a little bit of like a 5-minute Teams chat demo, so that we have time to kind of look at your responses, so that we can maybe provide some anonymous feedback live. And then we will talk about the rest of the how to create a measure tips, and have you kind of break into another group to discuss those. And then we'll just talk about office hours. So it's really all about today. There's a measure workbook that is on Teams that we'll be walking through how to fill that out and kind of why that's valuable. So prepare yourself for 2 breakout discussions and some interactive chat at some point today, if all goes well in the technology world. So first I wanted to just, again, one slide, just talk a little bit about what we covered last session, since it was a month ago already. We are using Microsoft Teams to post all of the materials and also to engage with you folks in between. If you have questions, there have been some good discussion starters on there already, so we appreciate folks who have kind of chimed in. There's a really great example that we didn't plant or pay anyone of someone asking a question, and then another colleague from the group, not the CCSI folks, who responded right away, and we really appreciated that, because that's sort of what it's there for, is to ask other folks questions who are thinking about similar stuff. So if you haven't already, please join us on Teams. We did also post an email also how to turn off notifications if you don't want to see everything, or to turn them on if you do want to see when we're talking over there. So if you're not familiar with it, there's lots of ways we can help you get just the right amount of information about what's going on over there. If you haven't already done so, please complete the baseline survey. This is our way of being data-driven ourselves, and I believe we'll chat over the link to the baseline survey in just a moment. If you have already filled it out, thank you. This is how we figure out whether we are hitting the right content when we kind of cover some of these things, see what else you need, and make sure that we are driving content that is valuable to you as you give your time to this initiative. We talked a little bit during session 1 about change leadership and change management, because this whole session and this whole track, and also the finance track, if you're on that one, are really trying to leverage the best practices of change management to measure what you need to measure and to have the right financial plans in place to really navigate the storm that is this pandemic, and also just in general to drive success as a behavioral health agency. I spoke a little bit about how change starts one person and one project at a time, because I think sometimes we get a little paralyzed thinking about how true organizational change requires a lot of people beyond just myself, but it's kind of, I think, a nice reframe to think that I can do one project as one person, and that's moving us along kind of that spectrum. We did talk a little bit about buy-in and how critical that is, and some things that harm buy-in. I think that's really critical as you're thinking about what the team is that's going to help you do some of this work. None of us on this call, I don't know, everybody's on the call today, but most of us can't do all of these components ourselves. We aren't both we aren't all the data person, as well as the strategist, as well as the executive decision maker, as well as the marketer. So we're not really all of those people at once. Although in some of your agencies, I know you guys do wear many hats. We spoke a little bit also last month about how the focus really on the telehealth on the front door side of things is really critical, as we've learned that we have to do business in a very different way in this current environment. So we talked about why the shift to thinking about engagement and access and telehealth is really the next critical piece of information that your organization needs to be able to understand and be able to dive into, which is why we're focusing on those elements of kind of key performance indicators in this track. We did talk about best practices for KPIs, key performance indicators, and then I identified for you that in this session, we're really going to focus on engagement and access as the two that I think if everyone had a good handle on those two, it would really go a long way to helping to inform your fiscal picture, as well as your utilization and how folks are coming in your doors, and what looks different in our kind of shifted environment. That's it for session 1 highlights. If that sounds really great and you missed it, please go ahead and watch the recording. Where all that kind of brings us to today is thinking about, so we covered, change is just difficult, change can be not so difficult if we kind of focus on it. We need to think about data differently in the current environment. We need KPIs that inform that. We're going to think about access and engagement as the two measures for this session. And so today it's really all about how we build the measures. For the sake of time, today we're going to talk about engagement for the most part as that measure. But we have a workbook for you. Again, it's available on Teams. You can pull it up right now. If you do pull it up, and Lynette will walk you through kind of what it is in a moment, but remember that you want to download a copy, because anything you type into it, everybody else can see. So you want to save kind of a copy on your desktop as well. The measure workbook is really, it's just an Excel worksheet, more or less, to help you define the measure. So again, whether you're using our engagement example or access example, or you're applying this to a different measure within your organization, the way the workbook is set up is to help you really think through being very precise in the language that you use, and therefore the data that drives that measure. And I think the reason those two, the precision is so important is that while conceptually, I'm sure everyone on the call understands access and engagement and why those are important, once you start to think about how you calculate a measure with your available data, the more precise you are in what is included and what is not included in calculating that measure, the more confident you are in how you interpret those results. And I think I've heard a lot of that from folks about other data sources. If you get a measure from the state, one of your core measures, you're wondering, well, but it doesn't include this group of people, or what does it do for that group of people? And I think the more precise you are in how you write out those steps for yourself, the easier it is to know exactly what you're saying about which group of people and what processes. The workbook will also help you document things in a way that you can repeat this process at a regular interval, maybe every quarter or every 6 months. You run the same measure the same way, with the same understanding, the same exclusions, the same data. And in that way, it standardizes this measure so that you're able to compare over time and across programs and things like that. It is very, on the surface of it, it's kind of simple. And I think it is a simple process. However, it's not how most people, it's not how many of us think unless we are trained in measurement. And so that's why we're going to go through it in a little bit of detail today. The way that I didn't even address the baking picture yet, I'm so sorry. The way that I like to think about the measures workbook is it's really you creating the recipe for how this measure will be created moving forward. It does not require you to get into the details about the very, very specific itty-bitty details That's really for your analyst, who in my metaphor, I'm going to just keep writing it out, is that's your head baker. You write the recipe in the measures workbook. You might say, knead the dough for 20 minutes. Your analyst is going to figure out what kneading is and measure that 20 minutes. So like the details about which data elements and how you're going to subtract this number from that number, that's not in this workbook. That is assuming that you have someone, maybe it's you in one of your other hats, who's going to play with the data later to kind of fit through the structure. This is the recipe. What are we going to do? What is it going to look like? What ingredients need to be in there? There is another tool that we have in there for you. I'm not going to spend time on it today, but if you need to think about what data is available to you, there's a data availability tool. We're very clever in our naming conventions over here, but it's very much walks you through what's the kind of the critical data elements that you might want to have available to you to create some of these measures. I put that fair warning bullet in there as a reminder to myself, because we're going to spend today creating a measure for you. And then you might take that to your analyst and say, here's the measure we want to do. And they might say, cool, we don't have this data element. And so you might have to shift your measure a little bit based on the data that is available to you. And I think the same, that's expected. You should expect that's going to happen, that you might have to kind of refine your language a little bit based on what's actually available to you in a quick way. So just anticipate that. I promise this is my last baking metaphor on slides, but after today, what the measures gives you, again, if that's the recipe and then you're going to hand it to your baker, after today, the next session is really more about how do you present and serve your baked good measure. So that'll be all about how you visualize it, how you communicated about it, and really how you take what you've created and kind of laid out and make it actionable and usable for people. So this session is all about what is the language that we need to define, and thinking about what we're measuring and what we aren't measuring. And the next session, it'll be about, okay, once we have some data, real or simulated, how do we want to talk about it? How do we want to visualize it? How do we want to communicate about it? So that's sort of what's coming next. Okay, and with that, I'm going to just check the chat, make sure no one has issues. Okay, great. The baseline survey link is posted in the chat. So if you haven't taken that, please wander over there. And then I believe I'm going to hand this over to Lynette. If you could just give your a quick introduction to who you are, and then take it away from here, please.
All right, thanks, Brandon. Hi, everyone. My name is Lynette Thielen, and I am a senior consultant here at CCSI. And I'm going to talk a little bit about your measure description, which is sort of the starting point of defining your measure, or what is your measure actually measuring. Go ahead. Oh, yeah, thank you. We like to use this acronym of your measure should be SMART. And really all of the elements that are in this component are the kinds of things that you apply to, when you're working on treatment plan objectives. So the same kinds of things apply to the measures that you're developing, right? You want your measure to be specific. Really define all of the elements of your measure: who, what, when, where, why, and in a way that anyone who reads it could understand it. Your measure should be measurable. That seems like it should go without having to be stated, but you really have to understand what is it that you will, what data are you going to use? How do you know that you've met the goal? And I think, as Brandon was mentioning just a moment ago, maybe there's something that you're thinking of that you just don't have the data for. So it has to be something that you really can measure. As you work on your measures, you're going to want to eventually develop a target. So your measures need to be achievable. They need to be within reach. So if you are creating a measure and you have a target for it that is just leaps and bounds away from your current state, it might be so far away that it'll be really hard for people to stay enthused about trying to reach that goal. So keep that measure and your target for your measure something that's achievable. It, of course, should be relevant, right? It needs to be meaningful to the organization, to the staff that is either doing the measuring or going to be communicated about the measuring. It needs to align to the bigger picture of your organization. If you're measuring something that nobody is looking at, it's not a great measure. It's not a good measure. And then time limited. So we need to define, as we define our measures, when that measure is going to be reviewed, When do we expect to see change? How often are we going to look at it? So this little SMART acronym is a great little test you can do as you get through defining your measure and make sure it meets all of this criteria. Thank you. So let's just start to build up how we get to a good measure description. And it might start with an idea, right? So we've got a few ideas on this slide. You want to measure how you improve access to services. You want to measure that the work you're doing is reducing ER visits. You want to measure that the services provided will reflect cultural and social identity awareness. So those are good ideas. Those statements, though, are not good measures. And how you get from that good idea to a good measure is by adding specifics to it, adding the detail. That's where you take that idea and you move it into an actual actionable measure. So we've got some examples here. So when you talk about, for example, improving access, it might be saying that we're going to measure families who initiate contact and that they're given an appointment within 2 weeks. We're going to measure that at least 75% of our referrals will be proactively contacted within 48 hours. So those you can see, you know, just by looking at the slide, the amount of detail that's in the measure, the better measure is much more in-depth, much more specific. And one thing I want to say too, because these measures actually incorporate targets, you'll have to assess if you're doing something, if you're measuring something brand new, you might not have a target yet. So you might need to get the measure, take a little time to start collecting data, and then from there you can develop a target. So that's something to keep in mind. And just a note, we have put a link in the chat for the workbook, and you can go to the workbook if you would like to kind of follow along in the workbook as we go through today's session. But just remember that you should download that workbook, because if you start typing in Teams, everybody's going to see what you type and everybody can type over it. Again, just going back to this, building a good measure description is about getting the specificity in there about what that measure really is. Next slide, please. Okay, so we're going to start and use an engagement measure as our focus as we talk through a little more detail about describing your measure. And we know that engagement is a really important component to measure right now, especially, you know, when within this pandemic time we're in, we've seen such big shifts in engagement. And as things move from here, you know, that's something we're going to want to keep an eye on. So a simple definition for engagement is the percentage of adolescents and adults with a new episode of alcohol or drug dependence who did not engage in 2 or more outpatient treatments within 30 days of the initiation visit. So just as we were looking at the examples, there's a lot of specificity in here. This describes what it is we're looking at. And if we go to the next slide, we can take a look at the HEDIS measure that is around this engagement measure. So the HEDIS measure is kind of a great place to start, to use it as a springboard to take a look at. So this is the full HEDIS measure. We do actually have a link right to that measure page. So when you get these slides, you can link to it if you want to look at it. But if we go to the next page, what we can do is kind of break it down and start to take a look at how we could use this as a springboard for developing an engagement measure description. So we've taken the 2 components that are very engagement related. And as we look at the items that we've got in the purple bold, those are the areas where the specificity is added in here. So, you know, assessing adults and adolescents, 13 years of age and older, that's very specific. That tells you exactly who you should be measuring from an age perspective. With a new episode of alcohol or other drug dependence. And there's specifics under the engagement in terms of having 2 or more services or an MHT service within 34 days. So while the areas that we have that are bolded are areas that are very specific, those also might be areas where you in your organization might have a slightly different definition. So those are the places where you can kind of dive in and determine what are the right elements to include in your definition of engagement for your organization. Okay, so this brings us to our first breakout discussion. What we're going to do is we've got you into assigned breakout groups, and we're going to be talking about developing your measure description. And this is really the starting point of what is your measure. And one of the other things to keep in mind as you go through this exercise and then as we go beyond it is you might find as you keep progressing through your measure specifications that you're going to go back and modify your description. So just get the starting point down. I'll put up a slide in a moment to talk about exactly what your topic is for your group, but just a few reminders about how we want you to function in your breakout group. Make sure that in order to have a really good discussion, that all voices are heard in your group, and that can either be through chat or just speaking up in your breakout group. Keep an eye on the time. I think we have 20 minutes allotted for the breakout group, so just so keep an eye on that. And then we do want you to do some reporting back and sending us some notes. So we would like you to send a chat directly to Brianna with your measure description. And then also, as we come out of the breakout groups, we want you to do a chat to everyone with either some questions that you were wrestling with in the breakout group, something that you thought was a really good idea that you want to make sure you share with everybody, or something that was surprising. So just kind of sharing some of the content of your breakout group. So 2 chats, one to Brianna with your measure description, one to everyone with some of your thoughts on the breakout group. And on our next slide, so this is going to be the topic for your breakout discussion. I do believe this slide will go away when you move into your breakout group. So just if you want to scribble down, whoops, we've gone off the slide. Thank you. If you want to just maybe write down this, so once the slide goes away that you don't lose it. You want to create a measure description, excuse me, either for engagement or for access. And what you're doing is really making a statement or two that describes what you're considering to be the engagement or access measure. So I think we are ready. Oh, great, thank you. And Brianna actually put that in the chat, so you have that as a reference. And I think we are ready to move into the breakout sessions. Just be patient, it takes a second for everybody to move into your breakout session. But we'll go ahead and start talking about a measure description.
This is one of those things that would be much easier in person because we'd say, turn and chat with the folks at your table. Thanks for hanging on for a second, folks. We have some backup plans if this doesn't work that well. There are a lot of you.
Yes, and this is Jocelyn. Forgive me, I'm moving some folks. So there was a couple folks that only had 2 people in the group that had showed up. So if you're moving and all of a sudden went from one room to the next, that's just me in the background making sure you have a group of at least, you know, hopefully at least 3 to 5 people.
Why can't I hear any?
Feel free to chat to me, Brianne, and specifically if you came up with a measure description so that we can chat about them. In our next section here. Also be how that went for you. And you can send them to me privately so that they stay anonymous. No problem with that. Give everybody another minute to come back. Okay, it looks like Jocelyn, is everybody back?
Almost. Yeah. Yep.
All right, so welcome back, everyone. I know there was a couple of technical hiccups there. This is always, it's a little bit challenging to figure out how to make this engaging on Zoom, no matter how many times we play around and practice with Zoom with this many folks and people who come in the middle of it or who didn't register, and then like wanting to make sure you guys also get a good experience. So thank you for your patience with us. Right now for the report back, if you could chat in a couple of things. So you can chat to me privately. Your measure description, what we're going to do is I'm going to kind of look through, and while we give you a little bit of a reminder about how to find us on Teams, I'm going to kind of pull up a couple of examples anonymously to chat about and to kind of give some feedback as if we were in a room together, only without making the 26, I think, groups, or however many there ended up being, 20 groups of you report back yourselves. So we'll do it via chat. And then feel free to chat to everyone. Anything that you'd like to share that you thought was kind of interesting or important to share. So something you were wrestling with, like a question you had, a good idea that you were all like, oh, hey, we should think about that you want to share with other folks. Anything that was surprising to you about the process, about thinking about the measure. If you have any feedback about how we did that breakout room in general, feel free to chat that over. You can send that directly to Jocelyn. Also, just to kind of keep the streams of thought straight so that we can figure out how to do it better next time. I can't promise that we can improve much for our breakout in 20 minutes or so, but maybe by next time we'll get a little bit better at it. So I see a lot of chat coming in, and I really appreciate that. We will be able to hopefully talk about a lot of these things in a few minutes. But with this, Jordan, are you, oh, I see you. Jordan is going to give us just a quick walk through reminder. It's partially so that I have a few minutes to look through your chats, and also just a reminder because I think that Teams is a really great place to find us. It can be during the breakout session. So we did notice that it was really we're not set up quite right for me to be able to pop into your rooms. So if you have questions or comments during the breakout conversations, if one of you has the Microsoft Teams app open, you can chat us live there, and all of us on CSI can see it, and actually everybody in the group can see it. So you can chat us there, and Jordan's just going to remind you about kind of where to go and how to do that. So I'm going to stop sharing and let Jordan take over for a moment.
Hi everyone, I'm Jordan Sturman, Research Associate with CCSI. Just give me one moment while I share my screen. So we just wanted to kind of give a quick overview of some of the main features that will really help you take advantage of what we're doing in Teams. So we're going to go over how to participate in the conversations on the Teams general posts. We'll show you how to privately message people so you can have a conversation one-on-one with anyone if you want to have any side conversations, and also how to access the files and resources that we post here. So for starters, this is the Measures and Methods PDA post page. This is probably what most of you are familiar with seeing if you've accessed Teams so far. So it kind of breaks things out into different conversations. So here we see Brianna just posted a new conversation, and then there are some other ones posted up here as well. So they're kind of broken out into these individual white boxes. So if you want to respond to a conversation, you click the reply box right below within this conversation box. So that'll let you sort of post within this thread, and then they'll just be organized chronologically with the number of posts. If you want to post a new conversation, there's a separate box right at the bottom here. I know a lot of people get confused between the replies and the start new conversation box since they're so close to one another. But if you want to start a new one, you'll just select down here. And then another feature that's really helpful is if you want to call someone's attention to the post, you can type in the @ key and start typing in someone's name, and they'll show up as a link within that post, and it'll call their attention. We'll get a notification to it. If you want to send someone an individual chat, there's a few ways to go about it. So one way is if you see something they've posted in the Teams posts, you can hover over their name or icon, and this will bring up some information about them. You can either select this little chat box icon here, or you can start typing a message to them, and that'll send a direct message to them and bring up a separate chat page. If you want to access all of your chat pages, right up here in the top left, there's this chat box, which will bring up all of your chat posts. And once you're there, if you need to get back to this Teams page, you just click the Teams and select the post thing. So there's, if you're participating in both tracks of PDA, you'll see Measures and Methods and Financial Best Practices. You'll just select the general, and it'll take you right back here. And let me just move the Zoom thing so I can select the files. So in order to access the files and resources that we're sharing, there are these tabs right at the top here. So there's Posts and Files. If you click on the files, it'll take you to all these different folders. So we have presentations, recordings, tools, and then these extra resources we've created. So the presentations are I believe they're just the PDFs of what we've shared. We've got recordings as well. So if you go to the recordings, we have the recordings of all of these Zoom sessions. And then in the tools, that's where you're going to find a lot of the documents that you'll be actually sort of interacting with directly. So for example, we were talking earlier about the Measure workbook, and Lynette mentioned not to type directly into this. So what you can do, instead of just opening this document, which will bring up a shared version that everyone sees and can edit, you'll want to do your thing separately. So if you go back to the Files page and go to Tools, so for the Measure workbook, what you'll want to do is right-click that and download it. So that'll download a separate copy for you to edit directly, and then you can share that with us, your individual one, instead of editing the shared one. And if you have any additional questions, feel free to reach out to us directly, either through email, Teams, using the features we just went over here, or even directly in the Zoom chat.
Thank you, Jordan. That was great. I did not get through all of them, but I got through some, and I think you guys have some similar questions. So since we have some more time for conversation soon, I'll hopefully get through more. So, and I can definitely look through some additional questions and measures you came up with during your next breakout session as well. I will share this screen. Did this in a very, very live way, so it's not great. I copied some of what folks had in terms of measure ideas. And again, I did not get through all of them. So what I wanted to do here was give folks an opportunity to see what others came up with and also have a little discussion. Given the size of the group, I'm going to lead this discussion, but I'm more than happy to have folks, since these are hopefully, these are anonymous enough, since no one knows who wrote what, to chat in their thoughts and questions as well. So in terms of measure ideas, there's a few things I pulled in here. So one group was talking about, there's some previous stuff, but they're thinking about their measure from the first phone call, that an assessment appointment would be scheduled within 3 to 5 business days, and then a follow-up appointment would be within 1 week. So from a measure perspective, I think this group did a good job of really defining those, the points of measurement really concretely. So that first phone call and then the assessment appointment scheduled. I think where I would want you to consider as we're going through the rest of this session today is like, where are you documenting that first phone call so that you can be sure that it's the first phone call and that everybody's answering and has the workflow that's the same way, giving you that first date of first phone call. And then the shiftiness that somebody else came up with in one of the questions on my next slide that I pulled up, which is, what about reschedules and no-shows? And I don't have a great answer for you, but if your measure is about first phone call to scheduling, and then the scheduling shifts, it affects your measure. So it's just something to consider. In general, I don't have the answer for you on many of these things. I just, it's easy for me to sort of see where the data, where you might want to think further about the data and how you articulate it. What I liked about that second bullet point is that that group just really understood quickly that sometimes you need a different measure for different programs. And I think what I wanted to say here is that's perfectly fine. It's really all about how you want to get your measure together and how you want to think about your programs and what kind of effort you want to put into it. There is a question coming through, and it's coming to me privately, and so I'll just encourage folks to respond to everyone if they would like to ask that question of all. But how are people tracking first phone call in? I think that's a great question, and I have some thoughts, and I'll talk about it in a little bit. But if you are already thinking about or tracking when someone first calls you, so the first like, hi, I need an appointment for my, my kid's substance use, how are you tracking that so that you have that data element? There's some question from your peers who would like an answer to that. If folks have ideas, please chat to everyone and answer to that. The third bullet point there, they have a benchmark, so that's something good. And I know Lynette alluded to that. We'll talk about that later, but they have that over the next quarter, there'll be an increase in the number of whatever it is they're looking at. And I think it's great to think about a benchmark that is also very achievable. An increase is not setting yourself up for a 99% success. It's just saying we're going to increase in this thing that's important to us. Which is a nice way to kind of use the precision of language to think about the direction that you want things to go in. The thing you're measuring there, again, this is one that I think it'll become more apparent as we go through the rest of these sections in the next 20 minutes or so. But thinking about what are you going to call successful contacts with members is just something that needs a little bit more articulation, I think, in order to make sure that everybody would look at it the same way. A couple of these others, I just was throwing measures in that I saw quickly so that you guys could get a sense for what other people are thinking about with these measures. And that's not all of them, of course. Oops, excuse me. But the measure of patients who leave an inpatient SUD care getting to their first outpatient appointment within 14 days, very consistent with the system and what insurance companies will be looking for and looking to pay. I think that the key piece for measurement, and this might not be an issue for your setting, is if you are the outpatient provider in that measure, how do you get the information about the patient leaving the inpatient service? But sometimes I know substance use services has you have a number of levels of care, so maybe it is your own agency. But I think that's where I would caution you when you're developing measures to really think about the data you have available. If your measure depends on getting information from an unaffiliated hospital about discharge, that's not a low-hanging fruit measure, because getting that data connection and getting that information from your hospital system or from your RIO or whatever it might be is a barrier. It's not an unsurmountable barrier, but it's definitely not going to be your kind of quick and easy measure to get off the ground. The last one there has some really kind of specifics in there. So I think it's really reflective of also what we'll be talking about today too, which is just the amount of time, I would say number of days between getting that referral in, again, where is that data and is everyone doing it the same way, and finishing intake. That also needs to be defined, but it's pretty concrete there too. Again, I wasn't trying to find good examples or bad examples. I was just grabbing the first few that came through the chat. So just we have some to talk about. And I will send more commentary on those over Microsoft Teams in the next couple days about common themes and things like that. These are a couple of the first questions and comments that came in. I see the chat is active, and oh good, people are chatting to everyone, so you guys are having a conversation that I can't follow because I have to talk, but I'll get on it in a few minutes. I think I like some of this stuff that came through, that it will be surprising, I think, to see the data, or I'm not sure if that comment is about whether you have the data or seeing what that data looks like, but I think both are probably true about what you find when you start to try to really measure some of these processes. How to count reschedules is an interesting one. My sense, and again, please feel free to chat how you've handled it if you guys have started some of this measure, but a reschedule, even if it's for a good reason, is still not meeting the measure in the most clean sense of the data. If you find that it's a consistent trend, so let's say it's what somebody else's measure was, this like between 5 days they'll have an appointment scheduled. I don't actually know if this is the same group, I apologize, but if I'm saying that my measure is within 5 days of that phone call, I'm going to have something scheduled, and then I find that 70% of the time that first appointment gets moved, then I'm going to think that there's something off with that measure. Either that time frame doesn't work for people, or it doesn't work for us, or something's off about how we're scheduling that appointment. So I think you kind of have to look at the data and then see what you want to do with the reschedules. If it's a particular subgroup of people that often reschedule, maybe people take the first appointment available and then they realize, actually, I worked that day and I can't do it. You might be able to find that, when moms call, they can't do the appointment, or when, young people call to make their own appointments. So whatever it might be, you have to just kind of look at the data and see what it means when folks reschedule. And sometimes it's just noise, and that just means you didn't hit that measure. And sometimes it means you want to redefine your measure a little bit. That's kind of complicated. I'm not sure I gave a great answer. Please feel free to ask it again, and I'll do a better job, not live. Some other questions that came up from the conversation there, how to measure referrals. Hopefully you guys are answering that on the chat. And again, I'll pop in and offer my 2 cents while you're in your next breakout session about that. And unsurprisingly, COVID is something that's challenging for everybody. I mean, and continues to be. And I saw that in a couple comments that the technical barrier, the technology barrier, is a really, really important piece right now. I think that's why we kind of settled on these front door metrics as critical in this time at the moment, because access and engagement probably does look very different right now for different reasons. For some folks, it might look better. I know for some adolescent kind of outpatient, more touch programs, it looks better because they're not in their after school curriculars. They like communicating like this. And so for some groups, it's actually better engagement. Families are less pulled in a lot of different directions, so kids and families can get in easier. But then for some folks who don't have who are your more vulnerable populations, who don't have a cell phone, who don't have reliable internet access, who don't have proficiency or literacy in Zoom calls and things like that, it is a barrier. And so I think why we focus on these measures is also to kind of see what's the data behind that. You doing this work, you have a sense for your patients. We as a system, we don't have a good sense for the kind of larger scale impact. So the more agencies that are measuring these things, the more we can put that information together and take it as a policy to New York State and say, hey, here's where we have holes and gaps and here's who's not getting served. So I don't have answers there, except that this group coming together and pulling this data can really kind of hopefully help shape some of that. I'm gonna take a quick pause to go over to the chat and see if anyone's saying something like, we can't hear you, which would be good to know before I get too far. It looks like it's still you guys chatting, which is great. Please keep that up. And I think we'll move on to the rest of the template. With our remaining time today, I wanna share with you some of the other parts of the template, and then we're gonna give you, well, we're going to see what time it is when I'm done with that, and then we'll see what we have time for today. So the eligible population tab on your measure workbook, I like to think of this as if you start with the assumption that the eligible population is every single person who's ever had contact with your agency in the past 5 years, all of you immediately are thinking, no, not everybody, right? And that's perfect. So what you need to do is if you start with eligible population, everybody that's touched our agency, now you start to add qualifiers and parameters until it makes sense. There's a little bit more art than science to this part because you just have to sort of decide who to exclude. And you exclude based on something that doesn't make sense. So in my example of everybody who's ever had contact with your agency in the past 5 years, that doesn't make sense for my current work, my current program. So I'm going to exclude and only look at in the past year or the past quarter. So now I've already made it one giant parameter that got rid of a lot of people. I might also exclude from my measure anyone under 21 because I'm not talking about my youth serving programs, I'm talking about my adult programs. So I've made some pretty broad assumptions that now kind of already limits the sample I'm looking at. The eligible population is kind of your big group of everybody who could be part of my measure. And then when you subtract out the exclusions, that's how you'll get your denominator. And again, in measurement speak, the denominator is the of all the people that have something, the numerator is the how many have this other thing. Very precise language there, I apologize. This slide will help. So denominator is measure speak, and it really thinks about who it is that you're referring to in this measure. It answers what percent of or how many reach this thing or have this level of engagement. So it would be of all of the people who call us for an appointment, minus people who aren't eligible, minus people who are actively suicidal, who we refer to a different level of care, minus people who aren't the right age. That's my denominator, something like that. Here are a few examples of different ways to come at it, and just to think about how you define your denominator really strongly shifts what your measure is going to be. If you are looking at, let's just do clients in a program. I'll jump to that so we can kind of save time. If you want to know how many clients in a program have a particular thing, maybe have a particular rate of satisfaction, let's say that. So how many clients are satisfied with our programs? You will get a different number if you are asking how many clients who initiate contact with us at all. So whoever called us and then we send out our surveys, that's going to be a different number. How many clients who attend an intake have a high satisfaction? Maybe you want to look at only folks who actually come and engage. So anybody who attends at least one session, or maybe it's 2 sessions. Or maybe you only want to look at satisfaction among folks who complete a program, who complete 80% of sessions, or who complete end of program surveys. All of those denominators will give you a very different rate, will give you a very different number for your measure because you're looking at very different populations. You're looking at everybody from someone who gives you a random call one day when they're in crisis to people who completed 80% of the sessions and filled out the survey. So how you define your denominator and what you consider in your denominator is actually really critical. It's a critical first step of figuring out how to make sense of that data. I want to only very quickly show you an example. I'm going to show you not this example here. If this is, for example, your average attendance, it kind of lines up with your engagement data. It's session by session for a particular program. Your average is this 59%. The average of all those time points is 59%. If you were to say, hey, our denominator is attendance, we're looking at attendance, and our rate is 59%, that tells you one story. But if you actually were to separate out your denominator in a way that made more sense or was more specific, you might see that average of 59% varies very much across different programs maybe, or different groups of people. Maybe one of those is older white females, and one of those is younger Black males, and one of those is Asian families. Like, they might look very different depending on how you filter your data. All of this to say, and just to show you that how you set up that denominator, how you talk about your eligible population, sets up whether you're going to interpret 59% as our average, or 15% as our average for one group or one program, and 98% is for another one, and we have a very huge disparity there. So kind of difficult to talk in generalities around this data, but to show you that how you set up that denominator has a lot of impact on how much you trust the data that you're going to get from it. I mentioned exclusions. That's another section on your measure workbook. Exclusions are some characteristics that just don't make sense to be in that group for some reason. I gave an example about age. Another might be, again, if someone calls you for an outpatient appointment and on the outpatient screener, the question of, you know, are you currently considering suicide or self-harm? It's not appropriate to send that person to your scheduling person to set up an appointment in 4 days. It's appropriate to refer them to the emergency room or to emergency crisis services. So those are the types of people that you would exclude. Someone where it would not be appropriate for them to follow this course of this, my expected pattern of engagement. It's a balance, as I said. So you want to exclude enough to make sure that you have kind of a clean image of what you're looking at, but also data that can be interpreted and acted upon. If you are thinking about the access piece, the very first part of getting into your services, if you exclude people who don't make it through intake, that's fine. If you're really clear that your measure is, of all the people who complete intake, how many of them attend 2 or 3 sessions in a month? That's fine if that's what you're looking at, but you're missing all the factors that keep someone from completing intake, which could be very important to your improving that rate, right? So as long as you are documenting and clear about what you're excluding and why, you can interpret that piece. It's just you're not getting the full picture if you're excluding too much. The question about demographics. Yes, true. So the question is, it almost feels like we can't know what demographics are important to break out until we break them all out, because how else would we know? Sort of true, yes. Next session, we're going to talk about visualization and communication about the measure, and that's where we'll talk about how to set up filters so that you can look at what's your overall rate of engagement. Great. And now what is your rate of engagement among this population, that population, those two together? And we'll talk a little bit more about how that can be helpful. And yeah, in the beginning, it is a lot of kind of exploratory visualizing and exploratory analysis. But then you'll understand kind of where your areas are that you want to monitor. But you are right about that. When you get to the time period, the point I want to make about time period is just that don't over measure a time period. So think about how often are you going to be reviewing your measure. If you'll be looking at this data every month and it's going to change every month, then you can measure it every month. More often, especially as you're getting started, looking at it quarterly is going to be okay. It's something that you want to think about. So this is, let's do the engagement example. If you're looking at all people who engaged, who had 2 services in 30 days after intake, then I want to look at that every quarter. I want to know of everybody who had an intake in Q1, how many of them had 2 sessions within a month, because that's how often I expect it to change, and that's how often I'm going to be reviewing it every quarter. So having monthly data isn't going to matter because I'm not going to look at it until 3 months later. You want to also consider your client flow and volume. If you're a small program and you only get maybe 10 new intakes a month, again, monthly is probably a little bit overdoing it on how often you look at that data. But also if you have a very large program and you do have a lot of clients that come in a month, and so you think it might be helpful, but you aren't going to be able to meet about it, or you couldn't drive change or a change initiative within a month, again, you just want to balance where you put your energy. The piece about measurement that I will have you think about, and this can sometimes make people go in knots, and it doesn't have to. If I wanted to measure, gosh, what is it, September now? If I wanted to measure of everyone who had a new intake in July, I want to know how many of them had 2 appointments within 30 days. I have to think about August, right? Because someone could have their intake on July 29th, and I need to give them 30 days to get those 2 appointments in. So that's all you have to think about with your time period is what is the time period, and then how much time do you need to get the data that you need. The look back period is if you're looking for something new. If you want only new clients, only new episodes of substance abuse, what do you consider new? Does that mean they didn't have this diagnosis in the past 6 months, year, 2 years? Does that mean they didn't have a service with you in the last 30 days, 60 days, 180 days? It's kind of, again, it's kind of build it and then see how it fits. But there are some standards in the federal measures around new episode that you can start with at least. But again, that's the data that you're going to need. When you give this recipe to your analyst, you need to say, I want to know for this quarter, And so I need this follow-up period and I need this look back period, or however that works for you. So that's just something to think about. Again, you don't have to figure out the details and the nitty gritty of the dates. You just have to be able to think about the concept of it. I'm moving quickly because I don't think we have a ton of time and I want to get through the talking points here. I will pause to say the details of this is the content of office hours in 2 weeks also. So if this is kind of a lot and you want to just kind of hear it first and then work on it and then come back and ask questions, that's the whole point of office hours, which are coming soon. Data definitions, this is anything that you created that needs, any terms that you created. So as I just said, if you're going to say for all new clients, how many folks get into our appointments within 2 weeks, you have to define what a new client is. And again, that can just be someone we haven't seen in 6 months. That's new to us, great. If you're going to define your admission visit, somebody was defining completed intake. What does that mean? Completed intake means they attended all 3 of these sessions, or it means this report is signed off on. What does completed intake mean? What does a follow-up visit mean? Things like that. If any data definitions is where you list anything that you would need, that I would need to understand what your measure is when you say that term, or someone else outside your agency. I think we aren't going to do the second breakout, because I believe we only have a few minutes and I want to make sure we finish. So now we know 1 breakout per 90 minutes is what we can get to. Okay, the last couple boxes, and then I promise I'm going to stop and answer questions. On the measures workbook, there's also a section called data sources and required data elements. Most likely your data source, hopefully you're going to say my EHR, and your analyst is going to take it and go with it, or you and your other hat is going to take it and go with it. Some measures, if you don't have a good data source, there are some measures available to you most likely within psyches that mimic some of these things. And I think starting with a measure is a great source if you don't have your own electronic data. Anything else you need to document there about the source so that you can replicate it. That's the key, is to replicate it. So if you need to get something from your billing system and something else from your clinical system, put that in this measures document so that when your analyst does this again in 6 months for you, they do the same exact thing. Okay. All of those steps, as you think through them and think through what you're measuring, and then who's in that measure and who's not in that measure, what time period you're thinking about, how you define new client or intake or admission, all of those things will bring you to your numerator and denominator, which is what this is all about. That gets you to your denominator among all of the thing that you've defined. That's where you bring in all those parameters and your data definitions. And that's the population that you really want to hit. So of all of the people who call our clinic, you ideally want to set that up so that like 100% ideally would be reaching good engagement, however you define that. Obviously 100% is too much of a goal, but that's the concept. The denominator is everybody you could actively, perfectly well engage. The numerator is how many you are during this time period. Make sense? Okay, so that we can get back to conversation. What I would suggest you do from this session, I have that right team? We're done at 11:30, right?
Correct.
Yep.
Making sure. I can only see the slides in front of me right now. So what I would suggest you do is you download a copy of the measures workbook and fill it out with your work group within your agency if you can, by yourself, just as an exercise if you want, that's fine. And we're gonna offer to look at it for you, just for you, like just send it back to you, not just the first person to send it to us. You email that, download it, fill it out, however much of it you want to fill out. You don't have to fill out the whole thing, just fill out what you're thinking or what you want feedback on. You send it to us by the end of the day on the 16th, and we will give you personalized feedback. So there's a team of us who will read through them and say, for this part, did you think about this? Here you want to define that. Here's difficult to get data on this. You might think about this date range. Whatever we, as kind of like if we were doing a one-on-one consultation with you, it's how we would help you think through that measure. It is feedback that you can take, you can leave, you can ignore, it doesn't matter. We may take some of your anonymous examples, again, similar to how I did today, where I took all of your names out of it and just kind of put some examples in and review them during office hours, particularly if there's like common questions or themes where everyone's kind of missing, like doesn't understand how the time piece works because I went through it lightning fast or whatever. So we might use some of your anonymous examples. If it's not anonymous, we won't use it. So if it's really specific to your one program that exists in the state, we won't use it because it's clear to you. But we would really like you to use us, you know, fill it out, give us your thoughts, let us react to you and give you kind of our first pass feedback. As always, please send any questions you have over Teams. Jordan did a great job kind of showing you where to go to find everything. If Teams is a headache, you don't have access, you can't remember how to do it, email pda@ccsi.org. Jocelyn gets every single one of them and lets us know if you guys have questions that she can't answer. You will see your registration links in a moment. They're on this next slide, so you'll get them in the slides and we'll also send them out. But we have office hours 2 Tuesdays from now on the 22nd, and there's 3 hours that we have available for you. The first 50-ish people to respond to any 1 hour get their first choice. So register for the one that fits your schedule better. What we will probably do, since there's a lot of folks, 50 is too many for 1 office hours, is that within that office hour, we'll have 2 breakout rooms. We'll practice it better. It'll be a smaller group. It'll be a lot easier. So that you can we'll have a live conversation around some of these questions. You'll be unmuted so you can participate and ask and react however you need to. So that's what office hours will be. We really encourage you to attend. It's not, I mean, none of this is required, obviously, but it will be kind of a deeper dive of some of these questions. So figuring out that measures workbook is something you would like to talk more about. That's what we'll do at that session. And also our next content session is going to be on Tuesday, October 13th. So mark your calendars, fill out the registration, join us for that. And with that, it's time for questions and open discussion. I'm going to actively be looking at the chat. If I didn't answer something that you posted before and you'd like it, feel free to post it again because there's a lot of conversation in here, which we love to see. But from what we covered today, thoughts, questions, feedback? I know this session is a lot of content and a lot of really, really boring content if you're not into measures. So I'm going to stick around. If you don't have questions and don't want to stick around, feel free to take 10 minutes back in your life. If you think of questions later, throw them on Teams, send them over again via email, whatever makes sense. If you have feedback about how this is going, pace, content, the breakout rooms, using Zoom, please don't hesitate to send that over as well. Again, your time is incredibly valuable and I know that, and anything we can do to make it more worth it or more valuable to you, we'd be happy to do. Thank you for someone validating that it was not boring. I'm sure there are other people thinking, yes, it was. So I'm happy to get both sets of feedback. So I'm gonna hang out for a few minutes. If you have questions, chat them in, and otherwise, thank you very much. And please enjoy your day. I'm going to answer that one live. If you do submit your workbook, we will be emailing you back feedback as well. So we might borrow some anonymous examples for office hours, for content to cover during office hours, or for examples to talk about, but we will be sending you back our live feedback.
Happy to see it's helpful for a lot of folks. Thanks so much for chatting in. Dr. O'Connor spends a lot of time. Got a lot of brain power in here.
There's a lot of team behind this for sure. And I do appreciate that my accidental fishing for feedback got a lot of it's not boring. So thank you for those of you who did that. It's good to know. Jocelyn, did you get my question about making sure we have the Teams chat all copied out? Yes, thank you. Okay. Just like
Yes.
Teams.
Just us.
Thank you. I missed a lot while I was chatting, so I want to make sure that we follow up on Teams with anything. Thank you all. I'm not seeing any more questions come in, so Giles, as long as you have the chat copied, we can go ahead and end the session. And folks, if you do have anything else that comes up, I think you know how to find us by now, and we'll see you soon.
Thank you. Bye.